Cardiac arrest is a critical medical emergency that demands immediate action. Understanding its nature, recognizing symptoms, and knowing how to respond can significantly increase the chances of survival. What is a cardiac arrest? Cardiac arrest occurs when the heart's electrical system malfunctions, causing it to suddenly and unexpectedly stop pumping blood effectively. Unlike a heart attack, which is a plumbing problem, a blockage in a coronary artery that limits blood flow to the heart muscle, cardiac arrest is an electrical problem. The heart's electrical activity becomes chaotic. In these rhythms, the heart's lower chambers quiver uselessly instead of pumping blood, or beat too fast to effectively fill with blood. This leads to an immediate cessation of blood flow to the brain and other vital organs. If not treated within minutes, cardiac arrest can lead to brain damage, irreversible organ damage, and death. The brain can only survive for a few minutes without oxygen, so every second counts. Key differences from a heart attack. Heart attack is a blockage in a heart artery damages heart muscle. The person may remain conscious, experience chest pain, and have time to seek medical help. A heart attack can lead to cardiac arrest. On the other hand, cardiac arrest is an electrical malfunction, causes the heart to stop pumping. The person immediately loses consciousness and stops breathing. This is a life-threatening emergency requiring immediate intervention. Let's discuss about the symptoms of cardiac arrest. The most critical and immediate symptoms of cardiac arrest are: the person will suddenly fall to the ground, they will not respond to shouts, shakes, or painful stimuli. They will either not be breathing at all, or will be making gasping or gurgling sounds, which are not effective breaths. There will be no detectable pulse in the major arteries. Possible warning signs. While cardiac arrest often strikes without warning, some individuals may experience subtle symptoms hours, days, or even weeks before the event. These are often dismissed, particularly in women, as they can be vague and not typical heart symptoms. These may include: it's more commonly reported in men, but women can also experience it. This can be pressure, squeezing, fullness, or a burning sensation. Shortness of breath can occur with or without chest discomfort and is more commonly reported by women. Feeling unusually tired or weak, even after rest. Feeling dizziness or lightheadedness, especially when exercising, sitting, or lying down. A feeling that your heart is racing, fluttering, pounding, or skipping a beat. Back pain also can be a symptom, especially in women. Flu-like symptoms such as nausea, vomiting, or belly pain. Fainting episodes, repeated episodes, particularly during exertion. It's important to remember that many people who experience cardiac arrest have no prior symptoms, or their symptoms are unrecognized. Therefore, knowing how to react to the immediate signs of collapse is paramount. Tricks to quickly relieve from cardiac arrest. Immediate interventions. There are no tricks to quickly relieve cardiac arrest once it has occurred. Rather, there are life-saving emergency interventions that must be performed without delay. These interventions are critical to maintaining blood flow to the brain and heart until professional medical help arrives and can restore a normal heart rhythm. The two most crucial immediate interventions are: starting high-quality cardiopulmonary resuscitation (CPR). CPR provides artificial circulation to the brain and other vital organs when the heart has stopped. It involves chest compressions and, ideally, rescue breaths. If you are not trained in CPR or are unsure about rescue breaths, perform hands-only CPR. This involves continuous, hard, and fast chest compressions. Position: lay the person flat on their back on a firm surface. Kneel beside them. Place your other hand on top of the first, interlocking your fingers if possible. Place the heel of one hand in the center of the person's chest, directly on the lower half of the breastbone. Push down hard, at least 2 inches or 5 centimeters for adults, and fast at a rate of 100 to 120 compressions per minute. Allow the chest to fully recoil after each compression. Keep your arms straight and your shoulders directly over your hands. Continue compressions without interruption until help arrives or when a person shows signs of life, for example, starts breathing or moving. If you are trained in CPR and comfortable with rescue breaths, follow the standard 30 compressions to 2 breaths ratio. After 30 compressions, open the person's airway by tilting their head back slightly and lifting their chin. Pinch their nose shut, take a normal breath, and give 2 rescue breaths, each lasting about 1 second, making sure the chest rises with each breath. Immediately resume chest compressions. Use an AED if it's nearby. This handy device can give your heart a jolt to get it back on track. It delivers an electrical shock that can stop the chaotic electrical activity and allow the heart's natural pacemaker to restart a normal, effective rhythm. CPR keeps oxygenated blood flowing to the brain and heart, buying time until the heart's electrical rhythm can be restored. Defibrillation with an AED is often the definitive treatment for ventricular fibrillation or pulseless ventricular tachycardia. Crucial point: these are not tricks, but essential, life-saving medical procedures that require immediate and decisive action. Early CPR and early defibrillation are the most critical factors in improving survival rates from cardiac arrest. Learning CPR and how to use an AED is a valuable skill that anyone can acquire.